very disheartening, very concerning, very sad.
A former employee at the Arizona State Hospital was hopeful for change there after they were assaulted while working. They left the field they were passionate about because of this incident.
That hospital is not run properly, hasn't been for a very long time.
Digging through reports, we found this person wasn't alone. Over the last 6 years, there have been more than 500 assaults each year. The hospital defines assaults as unwanted touching or other physical contact. Last year, more than 800 assaults. That's more than 2 a day.
You still have the fox watching the hen house for another who knows how long.
Will Humble is the former director of DHS. He says the hospital needed to be removed from DHS control for better oversight. He was frustrated to hear that part of the bill was gutted.
There have been a few suicides, one homicide, some escapes. Then you have the Department of Health Services licensing team going out and saying, no deficiencies noted. I mean, that's just not right.
So here's what the bill will do. Right now, to receive a court order for mental health treatment, you have to have a petition filed by 2 physicians. Now, in rural counties with 500,000 people or less, it's a little different. You can submit a petition for treatment from a physician and either one physician assistant or a psychiatric and mental health nurse practitioner. The bill's sponsor says this will help while the state deals with a shortage of healthcare workers.
Sadly, I'm afraid we've lost an opportunity.
The governor's office says the original bill would have been an unfunded mandate that would have increased costs without achieving her goals. The former employee worries what else could happen inside of those hospital walls.
I think we're all very disappointed and it's extremely concerning. I don't know how many more people have to die.
Now, Hobbs did tell us she will be putting more than $3 million into next year's budget. That way she can increase security at the hospital, and some do feel like that is at least a good start.
Well, gosh, nothing moves quickly down at the legislature at the Capitol, but, you know, during your reports, over the course of your reporting of this, you could hear people who are working there saying time is really of the essence. But this proposal really had strong bipartisan support at the legislature.
It did, passing the Senate 27-2, 9 out of the 9 votes in the Health Committee. So essentially, it kind of just crumbled down last minute in the House when there were those concerns from the governor. So that's kind of how it all unfolded. And like Jared said, we have done so many stories highlighting what is going on inside of these hospital walls. There's a QR code there on your screen. If you click that, it will link you to our YouTube Video Vault playlist. There you can watch all of these stories we have done. Jared.